Coping and stress. Stress is a normal part of life. It occurs with real or perceived threats and life changes. It can be external or internal. It can be positive or negative. Eustress is that positive stress and can be like getting married or starting a new job, where distress is the negative stress. We have a physical threat or trauma or psychological threats. Stress affects people differently. It activates the autonomic nervous system, or that fight or flight response. Resistance will occur after effective responses and the body functions return to normal. But if the responses to the stress are not effective, it can lead to exhaustion or, in extreme situations, death. Physical signs of stress will include cardiovascular, with a racing or pounding heart, elevated pulse, or increased blood pressure. Respiratory rate will be increased or hyperventilation. We may see muscle tension in the back, neck, and head that increases with stress. In the gastrointestinal system, we see decreased digestive enzymes or loss of appetite, decreased peristalsis, constipation, or diarrhea. And genitourinary, we have a decreased urine production or increased urinary frequency. Cognitive signs of stress include mild stress, which is increased alertness, or severe stress, where we see alertness decreasing, and it can lead to irrational or impulsive behavior. Emotional signs will include fatigue, tension, and anxiety, and the individual might appear distracted, irritable, or angry. Severe stress can lead to signs of major depressive disorders or suicidal ideation. Depression often occurs in conjunction with other physical and social changes. Now, depression is not a normal part of aging. Although it is common, it's not normal. It is likely to occur when the older adults perceive that they've lost control of a situation, or they lack the support of significant others, or that their normal coping mechanisms have been overwhelmed by the number or severity of stressors. Behavioral signs will include some people avoiding all interactions or tasks that might increase their stress level. Some people will take on additional duties in an attempt to block out the source of their distress. They may be scattered or disorganized, or they may self-medicate with alcohol or other substances. Stress and illness are closely linked. Mental and physical illness can cause stress. Stress can increase the risk for mental and physical illnesses on the flip side. It can lead to an increased risk for angina, heart rhythm abnormalities, heart attack, stroke, hypertension, gastrointestinal problems, and infection because of a decreased immune system response. With stress and life events, older adults that suffer from numerous chronic and/or acute conditions are under greater stress. A loss of friends, family members, and spouse can be highly stressful, and a change in residence or financial status can also cause stress. So common coping or defense mechanisms include repression, which is the removal of anxiety-producing thoughts or experiences from the conscious awareness. Denial is refusing to acknowledge some painful aspect of external reality that is obvious to other people. Rationalization is creating an acceptable reason for unacceptable thoughts or actions. Intellectualization is generalizing or to avoid those disturbing thoughts or feelings. Displacement would be transferring emotions about one situation or person onto another person. Suppression is avoiding thinking about distressing situations. Projection is attributing one's own feelings to someone else. Sublimation would be channeling negative energy into socially acceptable behaviors. And substitution is keeping so busy with activities that there's no time to think about those stressors. So there's two basic categories of coping style. A problem-focused coping strategy, which attempts to change or eliminate the stressful event or threat, and emotion-focused strategies that attempt to change the person's response to the stressful event or threat. One effective way of reducing stress is to avoid or escape the stressors. When those stressors can't be avoided, when their personal significance is high, or when the person believes that he or she can affect the outcome, other methods can be used, such as confrontational methods, cognitive methods, problem-solving methods, which identify and examine the stressor, then explore alternative actions to reduce stress. This leads to a proactive stance, choosing an active response to control the situation. A reactive stance will react to the situation and give the person a sense of control and empowerment. And then relaxation techniques. We have progressive relaxation, meditation, imaging, biofeedback, and self-hypnosis. So true or false? Those that have learned good coping strategies and have used them throughout a lifetime are going to continue to do so as they age. This is true. So when a person cannot appropriately or accurately identify stressors, they respond inadequately to stressors, they don't use or have knowledge of available resources or cannot solve problems or adapt to stressors, this creates a problem. Persons that experience limited or have limited coping ability may verbalize feelings of anger, anxiety, or sadness. They complain of changes in their physical function. They demonstrate inadequate problem-solving abilities or engage in destructive behavior or withdraw from contact with other people. These people have limited coping abilities. Risk factors will include recent social, physical, emotional, or financial losses, physical illness, major life changes. Goals are going to be to communicate those feelings of stress and identify personal strengths and effective methods of coping. Participate in decision making. Interventions are going to include maintaining continuity of care to develop a stable, trusting relationship. Encourage older adults to verbalize their feelings. Ensure older adults receive adequate nutrition, rest, and pain relief. Assist older adults in identifying their personal strengths and previously successful coping strategies. Explain a variety of stress reduction techniques such as self-hypnosis or imaging and meditation. And encourage older adults to participate in activities. Consult with medical health specialists, ministers, or counselors. And at home, encourage the family to provide emotional support to the older adults. Identify community resources that can provide support to the older adults and the family. And use an appropriate intervention that is used in institutional settings. So with disrupted living situations or maladaptive responses to those situations, there's a potential physiologic or psychosocial stress that occurs when the person is transferred from one environment to another. It is a common problem with aging. These older adults are likely to experience loss, fear, and concerns that can lead to stress. They may exhibit emotional, behavioral, or physical signs of stress. Goals include recognizing the reasons for the move or the change, identifying ways to maintain control and decision-making powers in the new environment, verbalizing concerns about new living arrangements, and identifying methods for coping with change. Interventions include encouraging verbalization of feelings, fears, and concerns about the move or change, discussing the reasons for the move or the change, including older adults in care planning, encourage a positive attitude about the move or the change, maintain continuity of care to enhance the feelings of trust, encourage the use of familiar objects and belongings, and at home, allow older adults to participate in decision-making and planning for the change, anticipate their fears and concerns, and allow them adequate time to implement the change whenever it's possible. And use any appropriate interventions that are used in the institutional setting. So question, once again, true or false? The changes experienced by the older adult with the relocation syndrome are only emotional. This is false.